Aid agencies are warning that up to 15 million people across the Saharan region of Central Africa are at risk of famine unless hundreds of millions of euro in aid is sent urgently. The food crisis is due to poor harvests and water shortages. Recent evaluations suggest it could affect more than 15.5 million people. Niger is one of the worst affected countries. Of its 13 million strong population, 60% live in poverty. Doctors say large numbers of children are arriving at their clinics severely malnourished. Tonight, in the first of a series on this crisis, RTE's Ray Kennedy is in the town of Tawa in Niger, where the clinic is struggling to cope.
Sawiba is aged just 1, but doctors face a fight to save her life at this overstretched clinic in Tawa, at the edge of where buildings yield to desert in Niger. Her mother brought her from their remote village. She's badly malnourished. There's no food there, she says, and now she fears for her little girl.
The area they're coming from, there is a real problem of food. There is not enough food for the families, and there are many cases of illnesses.
Sawiba is one of many at this clinic. Once the crops and rains failed, drought took hold and food disappeared. The people queuing at this clinic have travelled many kilometres to have their children assessed by the doctors here and hopefully admitted. The doctors say that the levels of malnutrition and its associated side effects are very severe, and the cases are growing in number by the day. This doctor telling us that the children arrive acutely malnourished, and in some cases their parents have first turned to traditional healers in their village before coming to the hospital. Irish Aid Agency Concern support the work here, and many are nursed back to health, but across Western Africa the situation is now desperate. Aid urgently required before a full-scale famine breaks out.
We have 11 staff members that we're paying to support the Ministry of Health. As you can see, it's the Ministry of Health who are doing the work. We've passed around and you see it's the health workers, the doctors, the nurses that are actually doing the work. So we just support them to do that. And we ensure that they have enough drugs and also the food that's needed to treat the children. We make sure that they have that.
For many, this is confirmation children need help. If the tape passes a red marker, they're malnourished and need medical assistance. This woman brought in her twins. Both showed red. Both were in need of food and water, like so many others across the region. Ray Kennedy, RTE News, Tawa, Niger.